بسم الله الرحمن الرحيم. المحاضرة بعنوان Bovine Leukemia or Leucosis. Definition of the disease: it is a malignant state of leukopic disorder. It is characterized by leukoproliferative changes in bone marrow along with appearance of abnormal premature leukocytes in peripheral circulation. It is recorded in dog, cattle, horse, sheep, pig, and cat. يعتبر واحد من الأمراض أو السرطانات الخبيثة اللي ممكن أن تصيب الأبقار، وهي مرض يصيب الدم ويسبب لنا زيادة أو تكاثر في عدد الخلايا الدموية البيضاء، وبهذا يكون الخلل موجود في البون مارو أو في نخاع العظم. The causes may be genetic factors or may be carcinogenic factors like virus-like particles. والمسببات ما تكون عوامل وراثية أو التعرض إلى عوامل مسرطنة. مثال على ذلك virus-like particle أي الفيروسات المسرطنة. There are 4 forms of bovine leukocytosis. Number 1, acute leukemia. A predominant blast cells are in blood, bone, and bone marrow. وبهذه الحالة الأكيوت لوكيميا تكون الخلايا السرطانية موجودة في نخاع العظم وفي دم الحيوان. Chronic leukemia, partly mature cells are in blood, bone marrow. Number 3, leukemic leukemia. Plenty of premature خلايا غير ناضجة leukocytes are present in the blood مع elevation of total white blood cells counts وزيادة عدد الكريات الدموية البيضاء، والتي يصبح عددها أكثر من 150,000 بالمليمتر المكعب الواحد. Leukemic leukemia, premature cells are moderate to few in number in the blood. Pathogenesis is the agent activate the cells reticular endothelial system, causing subclinical disease which characterized by lymphomatosis, which may last for months or years or the life. Course depend on the sites and spread of the growth of neoplasm. This is how the causative agent can, or what we call the virus, provirus, activated or it's called viral RNA, integrated fragments, its release, enter the cells and activated the cells, and the cells started make some damage in the DNA of the cells and lead to the development of the clinical signs of the disease. So here is the virus enter the cells, make some modification in the cells. Now all new cells are infected with the virus and newly infected lymphocytes deficient, and clonal expansion. Symptoms is depend on the which type of leukocytosis. But the more common clinical signs is enlargement of the superficial lymph nodes, enlargement thymus or thoracic lymph nodes, exophthalmos, unilateral or bilateral, bulging of eyeballs. Rectal palpation indicates enlargement of inguinal iliac lymph nodes, anorexia, weakness, depression, thirst, polyuria, fall of milk production, jaundice, ascites, dyspnea, coughing, apomazal, ulcer, and hemorrhage, posterior paresis in the advanced stage. This is the exophthalmos. This is advanced case of the disease, and this is examination of the superficial lawns and how the lymph nodes become very large in size. The diagnosis is dependent on the palpation of the lymph nodes, blood changing by blood smear, taking blood smear of the animal. Treatment, non-specific treatment, alkaline agents, folic acid antagonist, methotrexate, repeat blood transfusion, control prohibition of sale of the animal. This animal should be destroyed. غير صالح للاستهلاك البشري. Prevention of spread of contagious contact with other animal. This is the other clinical signs or how the enlargement of the superficial lymph nodes. The second disease is leukopenia. It occurs in many diseases. It reduces the resistance of the animal to bacterial infection. The symptoms depend on the main cause or causes. Broad-spectrum antibiotics are useful to prevent bacterial invasion. This is a calf suffering from leukopenia, and it will be suffering from other diseases such as diarrhea, dehydration. That's why this animal was treated with the fluid therapy to treat the dehydration. Edema. It is excessive accumulation of body fluids in the tissue space caused by disturbance in the mechanism of fluid exchange between capillaries, the tissue space, and the lymphatic vessels. It is accompanied by endocrine, circulatory, hepatic, renal changes. It may be local or general. This is the photo showing the edema accumulation in the lower part or abdominal part of the animals. Causes. There are different causes of edema. An increase in the hydrostatic pressure, which occurs due to several causes such as hepatic fibrosis or due to congestive heart failure, which we already explained in previous lectures. Compression of mammary veins by large fetus on the venous. This figure shows how the different causes due to an increase of hydrostatic pressure lead to develop of edema in the body, and such as there are heart failure may cause edema, renal failure, and also nutritional hepatic synthesis can cause also edema. This is the photo showing how the fluid exchange between extracellular space, vascular space, and intracellular, and how the osmotic pressure and oncotic pressure playing important role in the transferring fluids between extracellular or extravascular space and the capillary. The second cause is decreased plasma osmotic pressure, or it's called hypoproteinemia. It's occur in cases of renal diseases, causing continuous loss of protein in urine. Parasites such as Bacillus and Pneumococcal in ruminants, Strangulus in horses. Malnutrition due to defect in digestion, absorption, metabolism, utilization of protein. Decreased protein level in diet, impairment of liver function, vitamin A deficiency, copper deficiency, liver damage. This is also again how the protein or albumin play important role in the transfer of the fluid between interstitial and between the capillaries. Number 3, obstruction of blood or lymph or portal circulation due to tumors. Allergic condition also common causes of edema in the body, in which allergy or histamine-like substance are released, causing local libration of vasodilator, increasing capillary permeability, and dilatation of vascular damage of small vessels and hydrostatic pressure increasing, and this is more common in respiratory system. Toxins in the course of some infectious disease such as anthrax, black leg, malignant edema, pasteurellosis, filariasis, edematous skin disease, as well as equine infectious anemia, viral arthritis, infectious rhinopneumonia. All these causes can lead to edema. Etiological classification of edema depend either physiological or memory edema. This is cardiac edema, it occurs in congestive heart failure, renal edema, hepatic edema, pulmonary edema, or obstructive edema due to obstruction of blood or lymph or portal circulation, allergic edema, nutritional edema. Pathogenesis in normal state, the absorbed water reaches blood to enter intravascular space. Vascular water contain more protein, interstitial space, intracellular. There are constant flow to and fro between vascular interstitial water, which occurs between capillary, arterial, and due to higher hydrostatic pressure and lower osmotic pressure, and capillary venous end due to lower hydrostatic pressure and higher osmotic pressure, and the carrier nutrient metabolized to the body tissue. At capillary venous end, the reverse will occur. Number two, an increased condition in diseases condition, the pathogenesis, when the hydrostatic pressure increase and osmotic pressure decrease leads to an excessive fluid tends to pass into the tissue space. An excessive fluid tends to pass into tissue space instead of returning to the vascular system at the capillary venous. And number three, there are failure of fluids to return to the capillaries, resulting in accumulation of fluid into tissue space or escape into serous cavity, forming edema. Clinical symptoms of edema, it's a symptomatic classification of edema. Anasarca, it's subcutaneous formation of transudate in abdominal floor, sternum, brisket, intramandibular spaces, pharyngeal and perineal area. Ascites, it's transudate formation in peritoneal cavity causing enlarged abdomen will appear with pear shape. Percussion of the fluid is seen. Hydropsy, fluids formation in the uterus. Cerebral edema is manifested by nervous system. Hydropericardium fluids in pericardium causing obstruction of cardiac movement and muffled sounds in the heart, which we explained previously. Pulmonary edema is accompanied by respiratory disorder, nostrils, and frothy discharge from the nose. Common types of clinical edema, example of associated conditions such as mandibular edema, always we suggested parasitic, thoraco-abdominal parasites, heart, supraorbital fossa, pharyngeal region, pharyngitis, perineal area, buttocks region, black leg, other region, physiological or mastitis, limbs, hole or demarcation, heart, renal, breast region, heart, dula, pericarditis, head region, purpura hemorrhagica, swelled head in the arms, flu tongue, generalized systemic. Edema may be non-inflammatory, which we call it cold edema, or maybe local general edema, can be cold and painless. Swelling contains transudate serous fluids. The causes increase hydrostatic pressure and plasma colloidal osmotic pressure. While the inflammatory edema, or we called it hot edema, it's local edema, hot local or general fever. In unpigmented skin is very clear, caused by increased capillary permeability, which aggravated by blockage lymphatic capillaries with fibrin, clots, boils, cellulitis, trauma, infection, chemical irritants, damage of blood vessels, and obstructed by swelling or tumor. Diagnosis of edema, it's depend on case history, diets, renal failure or hepatic cirrhosis or parasites or infected with virus, loss sometimes of appetite, physical examination for For the edema, local or general edema, palpation of external lymph nodes, palpation of edema, abnormal cardiac or pulmonary sounds, jugular mammary or peripheral veins may be distended, pulsated, and cord-like. Laboratory examination include hepatic and renal function tests, serum electrolytes, and the differential diagnosis depending on the swallowing, abscess from, we have to differentiate edema from abscess, hematoma, tumor, biopsy, bursitis, inflammatory swelling of bursa, cyst, soft villus, diffuse swelling, which bit under finger pressure. While the treatment and management of edema, number one, depend on the cause or real cause of the edema. Treat the real cause. If it's parasites, we have to give antiparasites. Virus or bacterial, we have to treat the viral or we treat the bacterial infection. Cardiac edema, rest, adequate protein, salt-free diet, diuretics, potassium citrate and acetate, or Lasix, digoxin to لتقوية القلب, restrict water intake or even drainage of the sac, and the hydropericardium in equine, slaughter of cattle in cases of pericarditis and congestive heart failure. Hepatic coma, rest, treat the cause, parasites, infection, dextrose, calcium, liver extracts, amino acid, restricts water intake. نوت ملاحظة gradually aspirates. أحيانا نضطر إلى سحب بعض السوائل، ولكن يجب أن لا نسحب كميات كبيرة حتى لا تصير عند الحيوان volumic shock، وبالتالي gradually aspirate 2 إلى 3 of fluid in ascites and hydrothorax to avoid acute dilatation of splanchnic vessels which lead to peripheral circulatory failures. Renal edema, rest, sodium-free diet, amino acids, corticosteroids. In case of nutritional edema and hypoproteinemia, whole blood plasma expander, amino acids, iron, copper provided to the animals. In case of mammary edema, rest, diuretics, protein diets. While in case of allergic edema, antihistaminic or anti-inflammatory corticosteroids should be given to the animal. And number 8, in case of obstructive edema, symptomatic treatment or supportive treatment. Thank you.